Here is that same repetitive sequence we see up close. And those three deflections of the line are termed waveforms, all right? Waveforms are caused by changes in voltage as measured between 2 points in the body. Each waveform represents a discrete electrophysiological event in the cardiac cycle. The duration of the waveform. Example, an unusually long P wave, perhaps a sign of left atrial enlargement, or an unusually long QRS complex, perhaps indicative of some kind of conduction block in either the right or left bundle branches, right? So we can describe waveforms based on duration. We can also describe them based on amplitude. For instance, an unusually large or tall P wave may be a sign of right atrial enlargement, 0.04 seconds, right? Or 40 milliseconds. We'll talk about this in the next portion of our series when we're talking about calculating rate. So a normal PR interval is usually 120 to 200 milliseconds, which is basically 3 to 5 small blocks, right? If you have a PR interval of below 120 milliseconds, there must be some abnormal communication or connection between the atria and the ventricles. That typically happens in everybody's favorite Wolff-Parkinson-White syndrome, where there's a delta wave. We'll talk about that later. Or if your PR interval is prolonged above 5 small blocks or 200 milliseconds, that speaks to delayed conduction through the AV node. And we'll talk about that in the section of atrial ventricular block. If your QRS interval is less than 120 milliseconds, which is 3 small blocks, right, then you're probably thinking, you know what, it's a bit short.